All right, guys, welcome back to another episode of Man Talks to Camera Alone in Room. Today, I want to talk about hiatal hernia relief and acid reflux relief. So I have two categories. The first category is going to be just actual relief and coating the esophagus and the stomach, which may also facilitate healing. And then the second category is going to be healing. So I'm going to show you some supplements and food items that may help you feel better if you're struggling from these issues. So the first item is going to be aloe vera juice, okay? So there's some research that states that aloe vera has some healing properties, anti-inflammatory properties, which I mean we already know. It's pretty, people use it, sunscreen, etc. So there's some research that indicates that this may be able to coat your esophagus and help facilitate healing and lessen discomfort you may be feeling from acid reflux. All right. Honey, I like a lot. If you're waking up in the middle of the night, you're choking on acids, burning your esophagus, we always go to things like cough drops and lozenges. And a lot of times these things have honey in them, right? For a reason. It's going to coat your esophagus. All right. And then we have, let's do this one first. So DGL licorice extract. Let's try to get that to focus. All right, now the DGL. So if you have high blood pressure, right, there's some studies that suggest that licorice extract will spike your blood pressure. So it's not ideal for people with blood pressure issues. So DGL is basically stating that 99% of the chemical in this that will spike your blood pressure has been removed. So if you do struggle from high blood pressure, you want to make sure you're getting the DGL licorice extract specifically. And then the last supplement for coating the esophagus and stomach and helping to bring you relief and facilitate healing is going to be slippery elm bark. So slippery elm bark, same kind of thing. It's just used to coat your esophagus, help alleviate some pain. All right, so now I want to move on to the second portion, which is going to be some things that will actually help you heal from these problems, okay? One thing I think is good is just probiotics, right? Now, this could be hard if you have some GI issues because introducing this bacteria into your gut might cause some issues, some cramping, some bloating, some gas. So definitely something you might want to take slow. But I can't really see any issues with introducing good bacteria into your gut. All right. And last, as far as supplements go, that will facilitate healing, this is Pepsin GI. All right. And I have some notes on this because this is something that I actually learned about recently. So Pepsin GI, or zinc carnosine, heals the stomach by adhering directly to damaged tissue, where it slowly releases zinc to promote cell regeneration, stimulate mucus production, and strengthen the mucosal lining. It reduces inflammation, acts as an antioxidant, and inhibits H. pylori bacteria, helping to treat ulcers, gastritis, and leaky gut. Unlike other zinc forms, Pepsin GI specifically adheres to ulcerated or damaged areas in the stomach, providing a protective barrier that allows the tissue to heal. All right. So, all the supplements, there they are. Now let's move on